Hello, you're very welcome to this webinar. It's looking at developing resilience and coping skills within the context of COVID-19. And on behalf of AWARE, I'm absolutely delighted to welcome our two guest speakers, Nadine Ferris France and Dr. Keith Gaynor. And me, we're in conversation, the three of us. And my name is Claire Hayes. And Nadine is Executive Director at Irish Global Health Network. She has over 20 years experience living and working in Africa. And for the past 10 years, she's been in Ireland. And I'm going to put my glasses on to make sure I get other things right. She's also founder of the NGO Beyond Stigma. She's a practitioner, and I know I'm slightly biased because she's also a friend, but she's an excellent practitioner of inquiry-based stress reduction. And she works on global health issues related to HIV, gender-based violence, mental health, self-stigma, and shame. And over the last 9 months of 2020, Nadine has also been hosting webinars on an international perspective on COVID-19, which the Global Health Network and Esther Ireland have been running. So I'm really looking forward to hearing what Nadine has to say. And we're also in conversation with Dr. Keith Gaynor. And I suppose I need to be careful in just asking my friends to do things like this, but Keith is also a friend. He's also Senior Clinical Psychologist and Assistant Professor in Clinical Psychology in UCD. Keith specializes in cognitive behavioral therapy, CBT, for anxiety disorders and depression. He is a published author, Protecting Mental Health, and he is a regular contributor to media on a range of topics relating to mental health. And Keith is also a huge supporter of the work that AWARE does and is working with us as a volunteer as well. So I'd like to welcome both of you, Nadine and Keith, today. And if you'd just like to maybe give one or two introductory pieces, and then I'll come back to you, Nadine. So if I can start with you, Nadine, first.
Great. Well, thank you, everybody. It's a real privilege to be with you guys, and very unusual for me to be in this position, as I've been facilitating a lot of webinars this year, but not actually speaking. So wonderful to be here. And I love the topic of this. It really made me think when Claire invited me to speak. It made me think about what had I actually experienced and what had I learned in this year from the work that I was doing. And I guess there were four main takeaways. The first one was around resilience. So just in terms of how resilient people are everywhere, but particularly the resilience of people in the poorest countries in Africa and Asia. So that was incredible to me, resilience. Second one was solidarity. You know, the opportunity for us all to come together. It could be a time where people are very narrowly focused in their own, you know, their own country and their own issues, but I actually experienced firsthand the solidarity and people coming together and creating projects and doing things together that really showed solidarity across many countries in the world. And the third one was creativity and flexibility. I was amazed by just how creative as humans we can be. Incredible how when we're told we can't go this way, how we find a way to go that way. And I think the flexibility of people throughout this year has been really, really inspiring. And then the last thing I think I've noticed from all of the conversations I've had and been involved in is just the community response and how important it is for communities to actually come together and respond. And I think we have so much to learn from our friends and our colleagues in the developing world in Africa and Asia in particular. So, I mean, Claire, that's really kind of an overview of my thoughts. When I started to kind of drop them down, I thought, okay, they're kind of like the four main things that are kind of takeaways for me.
That's fantastic, Nadine. And it's a lovely introduction because it's getting us, well, certainly me looking forward to hearing more and teasing more out of that from you. So we'll put that on hold for a few moments. And Keith, thank you very much, Nadine. So Keith, in terms of looking at the area of resilience and coping, just a few pointers that you'd like to put in first, please.
Well, I'm just really struck by Nadine's summation of the year, and she summed up my year, I think, better than I ever could. Many of the things that I'm seeing that maybe have been different from other years are exactly as Nadine described it. That rather than mental health being something that someone else has, or happens somewhere else, or happens to someone else, I think we realized this year that mental health and mental health difficulties are something that affects everybody and can have an impact on anyone. And I think we really saw how this is there's a global impact to this and a universal impact to it. I think one of the other things that we saw is that how important that has been to reduce stigma, in that no one felt that they are to blame for the difficulties they're going through, because the difficulties are so obviously related to COVID. And of course, that's true all the time. That's true in 2019 and 2018 and 2016, that people were trying to manage really difficult circumstances and really trying times. But sometimes, because the causes were slightly less obvious than a global pandemic, people were more likely to self-blame, more likely to experience stigma, and more likely to internalize that sense of shame that somehow this was my fault or I was doing something wrong. And I think one of the key things in terms of resilience that we're seeing is people are recognizing, no, this is a huge impact. This is a wave that's hit me, and that I'm doing my very best to manage it. And that we're all doing our very best to manage it at the same time. And I think that those are the things that have stood out for me.
Great. And again, I look forward to hearing more from you, Keith, and that, and in response to Nadine. And just to put a context for this conversation, we're recording it towards the end of November 2020. But our sense is COVID-19 is going to be with us certainly for another while. So anybody who's watching this could be dipping in sometime in 2021. And a year ago, if we were to go back to November, December 2019, certainly from my experience, there was talk about a virus over in China, and it was way over there. And watching your webinars, Nadine, I just had a sense of being part of a global picture. I think it was the first thing that really knocked me out of being Irish in my small bubble to having a sense of, oh my goodness, you know I saw the reports from Italy and the UK and America, but to hear the people from the countries you interviewed really talking about how they were coping with COVID-19. And I think for us here, well, certainly for me, there's been a progression, sort of a little bit of maybe denial in March, April, May, maybe a sense of, it's fine, it's grand. And now I'm reminded of maybe what the soldiers in the First World War might have been feeling coming into their third Christmas. It's like, is this ever going to end? And a sort of a fatigue around it. So it's a wonderful opportunity to look at how we can galvanize ourselves, really look at the lessons that we've been learning and how we can develop resilience. So Nadine, back to you. And those 4 points that you mentioned, I'd love if you could develop them in whatever way you think would be helpful for us and for the listenership. Please.
Yeah, thanks, Claire, and wonderful to hear, Keith, to hear your perspective and talking about stigma and shame. I'm so passionate about these issues as well. I think, when I'm thinking about resilience, maybe just to mention, I mean, we've mentioned those webinars. We started off we're an agency that focuses on global health. So this was like our mainstream work was global health, and COVID came along and we thought, okay, how can we respond? What can we do that is useful? And I think we also see how organizations and agencies can be resilient as well. And that's what we found ourselves. So we decided, okay, we'll do a webinar on COVID, and we called it Convos on COVID, Conversations on COVID. We started the first one. We thought, okay, this seems to be useful. There's a lot of people watching. We'll do the second one. And now here we are at the end of the year. We've held 20 conversations on COVID at this point. We did weekly webinars. We were able to reach people. We had something like, I was looking at it today, we had over 115 speakers came to the webinars, and we've had over 15,000 people have viewed them. But what's amazing to me is people were able to take part from over 70 countries. Now that's phenomenal. So suddenly the boundaries and the things, even in global health, working in global health, these boundaries were not there anymore. And I think what's been fascinating, over this time, it's been such a privilege to host these webinars. We've been able to look at issues, very different issues about, for instance, instance, what lessons have we learned from Ebola and HIV in terms that could help us with COVID? What about gender and how that is working with COVID? We've looked at mental health, we've looked at stigma, we've looked at the effects on the health system, particularly in the poorest countries. We've looked at, COVID and nutrition. We've looked at the power of community. We've looked at social inclusion and disability and how COVID has affected people. We've looked at things like planetary health in COVID. We've looked at maintaining healthy schools. We've literally looked at, a whole range of issues in relation to COVID. And I think, to me, when I was really thinking about what I've taken away and what I've learning, it's, we've talked to people, we've had people talking from Ethiopia, Zimbabwe, South Africa, Tanzania, Vietnam, Ireland. Every time we did a webinar, we had people from Ireland, we had people from the developed world, the developing world. And we were always having that, there was like a balance, a kind of a natural balance moving forward back all the time. One of the things, really struck me is we had people from Zimbabwe, and I work a lot with Zimbabwe. I have many friends in Zimbabwe, and in Ireland we were locked down, and we were all kind of stuck in the 5-kilometer radius, and getting used to not being able to see our families and trying to adjust to working online. And if we couldn't, being supported by the government with the COVID payment. Our public health system was very clear. The messages coming from the government were very clear about what you could do, what you couldn't do, where you could get support. My friends in Zimbabwe, lockdown happened in Zimbabwe, and they, a lot of my friends there are friends and people living with HIV, and they are people who, work in markets. They run stalls, they're tailors in markets, and they literally go to work every day. The money that they earn that day, they go home, they buy food on their way home, and they feed their families with that food. When lockdown happened, they were immediately stuck at home. They couldn't go to work. So the biggest issue already immediately, and this was back like March, April, May, was food. So people were hungry. So people in Zimbabwe were hungry. And of course, there isn't a system, a social system or a support system. There was no COVID payment. There is no support like we would have in this case. And so people were really dealing with very, very severe and very severe issues very quickly. Other issues like medication, taking their medication for HIV. They weren't able to get to the clinics. They were able to travel to the clinics to get their medication. So they were stopping their medication for HIV, which means, people start to get sick, start to increase resistance. When they were traveling, if they were traveling, police were stopping them and asking them, why are you traveling? And then they were having to tell people, having to disclose their HIV state of violence and other things. So, they were also dealing with in their homes. And we definitely had that here. We saw that here as well, was, increase in gender-based violence. So people being in their homes together, and not women, particularly in domestic situations that are abusive, not being able to leave their homes, not being able to seek refuge. So some really serious issues. And then of course, issues like stock out of medicines. It was appalling to me to think, the medicines, you think of the supply chain and the transport of medication and how it gets into places. Well, suddenly we were seeing stock out in medications of medication even in the capital, like in Harare in Zimbabwe, or other capital cities don't mind rural areas. So, I think we also saw, one last point, we were talking about stigma. We had one amazing woman on from South Africa who was talking about stigma, and she was saying that in South Africa, fear was so huge, which of course it was here as well, so big, but people were looking for somebody to blame. Who could they blame in relation to COVID? And so they started to look at the more vulnerable populations, the LGBTI communities, people living with HIV, other vulnerable groups, and started to blame and to stigmatize those groups, creating rumors and stories about how COVID had been spread and had been brought in by those kind of groups. We actually produced a guide very early on with Beyond Stigma, which was really about spreading solidarity and love, not stigma and fear. And I think that'll be in the chat. We'll make the resource available for you there. So, I mean, so many things, Claire. I think I'll stop there and just hand it back to you. And, you know,
No,
just, yeah,
that's
I
brilliant,
could keep
Nadine.
talking about experiences. So back to
Yeah,
you.
no, and that's really I'm really enjoying and grateful for as well, the opportunity, because you do have a global picture. And one thing I remember as a child, every so often you're watching TV, you'd see a sign coming across, do not adjust your TV set. This is, you know, the station. So you had told us at the beginning that your network was a little bit unstable. So I think that's wonderful, because it's a great, just really proof of how you have been able to continue, and the people you've been working with right across the world have been able to continue with Wi-Fi that hasn't been working on top of COVID. So I think your shaky Wi-Fi at times actually adds to the richness of this webinar. So I just want to thank you for that. So Keith, have you anything in response to Nadine, and also what is it triggered for you to think about?
Yeah, I mean, I've been absolutely fascinated listening to Nadine, and it just reminds me, you used the word bubble, and I very much have been in my Irish bubble. And, you know, I think the 5K has made my mind even smaller. I've been looking inwards and inwards. And each of her kind of 4 points around resilience, solidarity, creativity, and community, I think they all have a dynamic tension that we've been seeing, maybe with their opposites. And so the opposite of resilience maybe has been vulnerability. And I think we've seen a vulnerability emerge in people because of COVID-19 that we wouldn't have otherwise seen. And that's been due to underlying health conditions, or having loved ones with underlying health conditions. It's been due, you know, there's a high rate of unemployment, a high rate of financial pressure, incredible home pressures, and that there's people who have become distressed and have had mental health difficulties who never would have, in my mind, if COVID-19 wasn't there. And so on the one hand, there's been extraordinary resilience, but there's also, it's shown, you know, vulnerabilities for people, that those pressure points have been really exploited. The other one is solidarity, and I think we've seen amazing solidarity, and the flip side of that is blaming. And while, you know, there's been certain groups have been blamed in the developing world, I think we've seen a lot of blaming of young people. I think we've seen blaming, you know, at various different points, it's that group. They're the ones that are bringing the risk. And I think we've really had to work hard to combat that. We are all in this together. We're only as strong as our weakest link. That actually everyone has been impacted in different ways, not in the same way, in very different ways, but that people have been really, really impacted by it. And to hold on to that sense of solidarity when there's a great urge to blame the person in the media, or the person in the press, or the person who's done the bad thing this given week. And on the one hand, there's been incredible creativity. And then because so much has been taken from us, I think the opposite of that has been stuckness, and how we can really get stuck if I can't see my friends, I can't get out of my 5K, I can't get to my class, I can't get to, you know, the thing that I'd normally do, and to my support network. That feeling of being stuck. Actually, what am I even allowed to do? I was talking to somebody this morning about dating. You know, this is a young person in their 20s who, you know, who wants to be dating. And I'm really thinking, how? You know, just the practicalities and how difficult that is for that person just to do the thing that's most natural in the world, which is to try and go out on a date with somebody. And so we can really get stuck in places. And then the last one is community, which I think we've all realized is the lifeblood that keeps us going. And, you know, Freud talked about the talking cure, but a lot of people talk about the social cure, that it's the social contacts that we have that keep us well and keep us resilient. And then, of course, this is a really insidious illness. It isolates us. We have to be far away from people. We can't hug, we can't touch, we can't go close. We have to separate ourselves from the people that we love the most, often to keep them safe. But then it creates this really acidic level of isolation that just eats us up, and that we're not a species that's meant to be alone. We do this much better together. I suppose that's what I've seen.
Yeah, that's really interesting as well, Keith. Thank you. And as you've been talking, I've been thinking about that we're all different. You know, that's a kind of a core thing in psychology, individual differences. And I think some of us have experienced challenges, as you said, at different times. And one of the things that has struck me over this period is people I've known in the past who have experienced difficulties, challenges, severe anxiety, severe depression in the past, surprise themselves at the beginning in terms of how well they were coping. Whereas people who had not experienced those difficulties were really shocked by how, in their words, poorly they were coping. And then as we came to the end of the kind of 4 or 5 months lockdown initially, then there was a sort of a reverse. So people who were used to staying at home with depression were saying, well, actually, I'm nice and comfortable. I don't want to go out there. And the same with anxiety. And there was what an RT journalist, Janet Flaherty, called re-entry anxiety, going, you know, the anxiety around going out. And then, you know, there was a sense of hope, and then the disillusionment and the upset, and we're now coming towards the end of a second period of severe restrictions. So we know we're all looking forward to Christmas, and it will happen in whatever way it happens. But even in one of today's papers, there's a heading, you know, get ready for the third lockdown. So what would you both have to say to people to help build resilience? So the future is we have at least 3 vaccines that we hope in 2021 will be effective, will work, will have no side effects. But at the moment, the evidence isn't fully there because the research just isn't complete to the best of my understanding. So the likelihood is that we will still need to social distance, hand wash, mind ourselves. So COVID-19 isn't just going to go away next week when we come out. So Nadine, what advice would you have, or what have you noticed in terms of people who you see as coping really well, that you can share that with us?
Keith, do you want to go ahead?
Yeah, so happy to go ahead there.
Okay, apologies. Yeah, Keith, perfect.
Yeah, no
Thanks,
problem.
Nadine.
I think there's Nadine's 4 themes, I think, are perfect, and really working hard to keep them. So how do we keep the solidarity?
Yeah.
How do we keep a sense of community? How do we keep a sense of creativity and doing something new? So Christmas will be a creative Christmas. It will not be a traditional Christmas. January is going to be a creative January. How do we do the things that we know we need, but do them in new ways? How do we keep the people that we love, even though we have to keep them at arm's length? And how do we keep a sense of group and community and not get divided? I think those are really key. And I'd add 2 other things in terms of just psychological resilience. That worry and decision making, I think, have been particular difficulties for people. That often, because we're isolated, we're thinking and rethinking and overthinking the difficulties that are going on for us. And that creates a lot of stress for us. And so if one of the things is, if we can identify when we worry, what we're worrying about, and to try and reduce the amount of time we're spending in our own heads, I think that's very helpful. And the other thing I think COVID has brought out is it causes a lot of decision making. So my brother-in-law's birthday is coming up this weekend. Can we meet? Where can we meet? Can we have a coffee? How many of us are going to meet? Are we going to meet in one place and go to the other place? What happens if it's raining? And suddenly the simplest of things, meeting someone for a birthday, has become a decision-making minefield. And that's exhausting. But the more we're having forced to do that all the time, I think it's just an acknowledgement to ourselves that that's an exhausting process. Going to the shops. Should I go to the shops? Should I go at 9 a.m.? Should I bring bags, not bring bags? Will I get it delivered? And that's exhausting. And we're doing that all day now and forced to do it. And there'll be new restrictions or reduced restrictions and then new restrictions. And we have to rethink everything again. And so a real sense of compassion towards ourselves, that this is hard. Living through a pandemic is hard. We're not meant to be doing it perfectly. We're not meant to be living these perfect lives. We're not meant to be baking banana bread and learning how to surf. Actually, it's okay to find this hard and tiring and worrying. And to really bring a real sense of self-compassion, I think would be really helpful.
I fully agree with you, Keith. And I'm delighted you said that, because I certainly personally felt a lot of pressure a few months ago that I wasn't making the most of this time, that I needed to be doing more and more and more and more. And, you know, it was crazy. It was ridiculous. I was working as hard as I could, and still this sense of, no, I need to do more, and not making banana bread. And then hearing about other people and thinking, oh, I'm not doing that either. And my, I suppose, way of helping people cope, develop resilience, I love what I call the ABC coping sentence. So A, acknowledge, and just exactly what you said, Keith. I feel upset, I feel scared, I feel tired. And of course, there are some people who are really enjoying this time, and they're feeling really delighted that they don't want to go back. A lot of children I've worked with don't want to go back to school, or certainly 4 months ago did not want to go back to school. But I feel upset, I feel distressed. B, so A, acknowledge. B, because, and it can be because we're in the middle of a global pandemic, or because I think this is so terrible. And this is building up for you, Nadine, in terms of my question for you. So looking at the thoughts, I think, as opposed to a reality. And sometimes it is our thoughts that cause the problems, not the actual reality. So A, acknowledge. B, because I think whatever. And then C, what do we choose to do? And this is wonderful. This is where we have a choice, not that we have to make banana bread, or we have to, or we must, or we should, but what do we choose to do? And for me, I choose to make this time count. I choose to remember we will get through this. I choose to recognize and appreciate what's going well. And for those of us who have lost people that we love through COVID-19, or during the time of COVID-19 where we weren't able to mourn them in the way we normally would, but I choose to trust that somehow we will mark this in our own way as best we can. So coming to those three parts, so acknowledging, and then because, and then choose. And Nadine, you're smiling. You know where I'm going to bring you back to your inquiry-based work. And you've done a lot of work, and in the conversation with you recently, you were talking about helping to challenge people's own belief system around COVID-19. I'd love if you could tell us a little bit about that, please.
Yeah, thanks, Claire. And yeah, I'm just really enjoying this conversation myself and learning so much. I think, when the pandemic first started back in April, May of 2020, I started running a series with a friend and colleague of mine called Peace in a Pandemic. And we opened an online space for people to come, and basically to come with their thoughts, to come and share what their thoughts were, mostly around fearful thoughts. People had so many, and still have so many, fearful thoughts. I'm going to die. People I love are going to die. A lot of fear watching other people going out and not doing what they're supposed to be doing. She shouldn't do that. She should do that. A lot of uncertainty. And so we started working with people and their thoughts. And I think, Claire, you said it as well. It's like, there's the situation of the pandemic. That's what's happening. That's real. That's happening. And then there's the meaning that I place onto what's actually happening, the situation. And so looking at kind of slowing things down and looking at, okay, what is it that I'm thinking and believing about this situation? Because that's what causes the stress and the suffering and the panic and the worry that Keith was talking about. So we're doing these series of workshops where we were looking at what those thoughts were, and then using inquiry-based stress reduction, this approach of really questioning thoughts. So is it true? Just looking at that simple, is it actually true? And then looking at, well, how do you react? How does it affect you when you believe a thought? For instance, like, somebody shouldn't be doing something, they shouldn't be doing it, and noticing the effect on yourself. And then moving that process through the questions to turn it around and look at things in a different way. It's like looking at, okay, what is it that I shouldn't be doing? Or what is it about them? Is there some reason why they should be doing that? So just kind of loosening the hold that thoughts have on us. And certainly in my own life, I've come to see that, what I'm thinking and believing is what creates my life. And that's really exciting, because it means when I question what I'm thinking, I have the power to actually decide how my life is going to be. So I'm really grateful for that practice.
Yeah, that's great. And I see COVID-19, that there are aspects of it that are gifts. And in terms of developing resilience, my work with parents and children, children are being put in a position where I've seen parents working with me, and the door opens and, you know, a child comes in and the parent immediately says, I'm in a meeting, I'll talk to you later. And my sense is that that child before COVID would have been immediately have got all the attention, and the parent would have just turned and focused, and there's a balance. You know, we don't want to be completely 100% at the call of children, but we don't want to completely ignore them either. But I think it's an opportunity for each of us at any age to learn that, oh, we can get through this. And, you know, the 4 points that you both mentioned, perfect. And Keith, I could see you nodding when Nadine was talking about the thoughts, because I know, like me, you're just passionate about CBT, cognitive behavioral therapy, and teaching people the basic principles of those. Is there anything you'd like to add in there?
Well, I suppose a little like Nadine, I've been seeing people all summer coming with difficulties related to COVID and anxiety and depression related to COVID. And I was nodding because I suppose those were a lot of the thoughts that I was hearing in session. And I'm fascinated to see that Nadine had them on a very broad scale through our workshops, because I suppose that's what I've been seeing individually. And that so many of that fear was fear for others, and that people were worried about people they loved dying. And partly it was sometimes fear for themselves, but even once fear for themselves is, well, then who'll mind my children? Or who'll mind the people for whom I'm responsible? And so at the root of that fear, I found there was a huge amount of love and sense of responsibility and sense of care for the people around them and people in their network. And that was the root of an awful lot of those fearful thoughts. And we've been doing, I suspect, similar work over the summer, trying to help people manage those thoughts and understanding the meaning beneath it.
Yes.
And just how important it's been and how difficult it's been for people.
Yeah. And it's so true. And one of the ways I've been working to help support people with that fear, the fear of death, and that's not just COVID-19. It's, you know, that's been going on for as long as I've been working with people and life, but particularly this year. But suggesting if we knew we were going to die this time next week, you know, our loved ones were going to die this time next week, and we knew that for a fact, what would we do in the meantime? And practically everybody would say, well, in some way of describing it, we'd make that time count. So yes, of course, we'd feel upset and we'd feel worried and we might feel angry and all of that, but we'd actually use our time. And then I would say, well, when is the time to worry about that? Is it now today, or is it if or when it happens? So it's getting the balance between, yes, I am worried about other people, but then also trusting them that their journey is whatever their journey is. We cannot live their journey, but by living our lives as best we can, then we can support them in their journey. And I've had so many conversations this year about that. So I think it's very much at kind of stroke spiritual philosophical discussion. And in terms of coping resources, we know Hammer is somebody, I used his research tool in 1988 to help people to measure how people cope with stress. And he had 5 measures. One is cognitive thoughts, we've talked about that. One is emotional, and ability to express emotions, be in touch with our emotions. 3 is social support, and Keith, you and Nadine, you talked about that. Not the griping, not the talking about how terrible things are, acknowledging that, but really being able to have some fun as well in the middle of it. And then the 4th is what we all know, the physical. So the exercise, the diet, the sleep. But his 5th one was one that really struck me, spiritual stroke philosophical. And that's the bigger picture. That's where Nelson Mandela, Viktor Frankl, Brian Keenan, anyone who's experienced huge adverse difficulties, they've been able to see a bigger picture. And I think the gift of COVID-19 is challenging all of us at every age to look at the bigger picture. And that's why I loved your work, Nadine, because you're looking at the bigger picture internationally. And that really jolted me out of my little box.
And it's interesting because I'm thinking, you know, those themes of solidarity, resilience, coping, it's kind of running through my mind and my heart at the moment. And I'm thinking of, you know, one of the things that was really incredible for me was how I was so inspired, and I still am so inspired by all of the people that I have met. from no matter what the circumstance. And I was thinking about, how people have worked together in solidarity. And, when I think I mentioned it at the beginning, when the pandemic first happened, a lot of people start to think inward. And like you said, Keith, I go even in my 5-kilometer bubble. It's like I go into my country, into my 5 kilometers, and then I go into my head. And then I'm kind of like totally insular. And so for me, it was like having, every week it was like out. And people, I noticed that people in Ireland, what an incredible people we are. When all was happening in Ireland and things were really difficult here for people, and like I support in the Esther program, we support a lot of partnerships. So hospitals that work in Ireland who partner together with hospitals in countries in Africa and Asia. And at that time, I remember thinking, okay, well, now they're going to just focus their resources on Ireland because they need, they need all the healthcare workers they can get. They need all of the resources. But guess what? They didn't. It was like people tried even harder to connect with their partners in the developing world. And there was incredible things happened this year. The Crumlin Hospital here in Dublin partners with a hospital in Tanzania called Muhimbili Hospital. And they support basically a ward for oncology, so for children, for pediatric oncology. And when this happened, and when COVID happened in Tanzania, one of the Irish doctors who works out there, Trish Scanlon, she started to see that on the ward, the children started to starting to get infected with COVID and die. And of course, because their immune systems are so compromised, right? And the hospitals had absolutely not got PPE. They didn't know how to manage COVID. They weren't able to respond as quickly as a country like Ireland. So it didn't take long for Crumlin to mobilize resources, advice, doctors, money, all that kind of thing. And very soon they were able to have a safe environment working in Tanzania where the children were able to continue their care, which was so important for cancer during this time, but also in a way that was safe. We saw a small GP surgery that works in Gori. Can you imagine Gori down in Wexford? And they work with an organization, a hospital in Malawi. And immediately this happened. They're seeing their patients, they're dealing with it here in Wexford. And they immediately ask their partners in Malawi, what can we do to help? What do you need? What can we do together? And the partners in Malawi say, well, can we work together on educating everybody around COVID and preparing the health system and the hospitals? So they basically just, completely with no background in this, they designed together this incredible series of COVID videos. They produced 15 animated videos, which we'll share in the chat, which basically, spells out what is COVID, how do you protect yourself, what if you're coming in and you're a cancer patient, what if you're a HIV patient, what do you do, where do you go? Incredible. That series has had over 2 million views. And it was incredible. That's kind of going back to creativity. It's going back to working together. It's going back to solidarity. It's going back to community. And the partnerships got stronger as a result. So originally you would think, one, the support won't happen. And two, we won't be able to travel, so it won't be so meaningful. Well, that wasn't the experience. And, at the moment I'm working on, we have World AIDS Day coming up next week. It's the 1st of December. It's celebrated all over the world. And it's a day where we get to remember all of our friends who have died of AIDS and all of those who are living positively with HIV. And we wanted to do something that really showed the theme is solidarity in a time of global crisis. So we have this incredible youth choir from County Kildare, the Suso Youth Choir, made up of Irish young people who are basically partnered together with Jandiri Youth Choir, a youth choir of young people living with HIV in Zimbabwe. And they've been meeting every Saturday for the last 3 Saturdays, and they are doing a music collaboration together. They're going into small groups, they're meeting each other, they're sharing, how are you, what was your childhood like, what things do you want to do when you get older? They're just sharing experiences. What music do you like? And they're creating this music video that we're going to launch next week on the 1st of December during our World AIDS Day event. And it's incredible, total solidarity. Last week, we asked the young people in Zimbabwe and in Ireland, what have you gotten out of this project? And so many of them, it was so clear. They just said, this has been a terrible year, but we have so enjoyed this project, has given us hope. It's made us see that we're, people in Ireland are the same as people in Zimbabwe. We can do things that we never thought were possible and even sing together. So there's incredible stories of inspiration. And I think that kind of goes back, Claire, to one of your questions. It's like, I think that finding a sense of purpose. And for me, it's always about, is there something I can do? Is there somebody I can support? Because that really feeds into a sense of purpose, and it takes me out of here and out of the 5 kilometers and into the world. And there's, it doesn't matter if it's somebody that's very far away or somebody just down the road. I mean, look at the GAA and how they started shopping for all our older people in communities in Ireland. We can all do something. And I think a little bit of action where it's not focused on yourself is really helpful for our heads, for our hearts.
That's fantastic. And actually, now that you mentioned the GA, and I didn't tip you on this, I'm wearing blue and white. So up Cavan, who won the Ulster final, just in case there's anybody who didn't notice. And hopefully people are watching this will have also beaten Dublin in the All-Ireland semi-final and gone on to win the final, but that's possible or not. So I just love your energy, Nadine. I'm just struck by how many conversations you've had on COVID-19 through the year. And my sense listening to you is that you're energized, you're not jaded in any way. And what you have to offer is just incredible. So I'm thrilled that you're sharing this with us. And I know a lot of the links you've mentioned are in the box below. And I think the GP you referred to might have been Dr. Andrea Rochford and her team. So if that's so, I'm not one bit surprised. And what struck me is that communities,
absolutely, Andrea Rochford, Joe Gallagher, Peter Harrington.
Yeah, the psychology community have come together, the Institute of Guidance Counsellors, the teachers, I think every professional body in Ireland, and it's wonderful to hear that they're making links internationally as well. So Keith, what would you like to say? And kind of coming towards the end of this conversation, what would you like to put in?
So I suppose I would just echo Nadine's last words, that it's about meaning and it's for the head and for the heart. And that what we're trying to do is to move away from the head. That this year has, we've been a news overload, information overload. As wonderful as NEFIT has been, their nightly briefings where we are getting numbers and caseloads, and it's all in the head. And actually moving to the heart. What brings us meaning? What brings us joy? What brings us hope? And that's the place where we'll find resilience through this. It isn't an academic answer. It isn't an answer that a number is going to do it for us. And that is where we find connection. It's where we find solidarity. It's where we find meaning, and it's where we find community. And that will help us be resilient, however long this goes on.
Yeah. Absolutely, I couldn't agree with you more. And I'm just wondering, when you were doing your training to be a clinical psychologist, how many lectures did you have on the importance of love in working with people and compassion? And, I think as we've evolved, we know compassion-based psychotherapy is really, really important. But it comes down to the core of it in terms of the love. And I think that's one of the gifts of COVID-19. So thank you, Keith. Nadine, last word to you. Is there anything you'd like to finish with?
I know this is going to be a strange one, but I always love to come back to yourself, because I think sometimes on these webinars, you can be talking about things rather than who you are. And I love to come back, just really take it home. And it's like, what helped me during this time, what continues to help me, what brings me, how do I get joy and hope and compassion, and there's a couple of simple things that I love to do. One of them is sea swimming. I swim in the Irish Sea every day if I can, and that brings me to the present moment like nothing else, like no other meditation that I've ever done. So sea swimming. I work with my mind as a daily practice. So I also get thoughts like, this is a really hard day. I'm really struggling. I don't think I can do it. And it's like looking at myself and continuing to catch myself in my own practice of working with my thoughts, and particularly using like inquiry-based stress reduction, the work. Connection to nature. I know we've said it, but in COVID, we're in this 5 kilometer bubble for a lot of the year. So it's like looking up. I'm looking up in my office, I can see the sky. And it's making sure, even if all I can see is the sky, then I'm connected to nature. Or I go out and I pick up a leaf and I just remind myself what nature is is so important to me is to stay connected to people. And I think I have never, I used to be a person who traveled all the time. I was traveling 1 week every month for as long as I can remember. And this year I'm sitting in the cabin in the back garden. And yet I have been to more countries, I have spoken to more people, I've been inspired by people doing incredible things in ways that I wasn't able to be before. So stay connected to people and find a way to do it. So I just think taking it home, just a couple of messages for people, just from what I'm learning for myself.
Well, look, my sense is this conversation will be continued, and I'd sincerely like to thank both of you for giving up your time, and gur míle míle maith and mahagwith. So thank you, 1,000 thanks to both of you. And we'll leave it there for the moment. Thank you.
Great.